Hello, and welcome to Parenting in the Age of the Coronavirus, a new podcast from the Murdoch Children's Research Institute in Melbourne. My name is Professor Sharon Goldfeld, and I'm from the Murdoch Children's Research Institute. And in this podcast, I get to be joined by some of my friends who are absolute experts. I'm going to introduce them to you in a moment, but just to remind you, this is the fifth, actually, in a series of podcasts that explores the way that parents and the coronavirus are having to interact in what we are now calling these unprecedented times. And we're going to focus quite a bit on how children and parents might work together as they go back to school. Before starting, MCRI, the Murdoch Children's Research Institute, would like to acknowledge the traditional custodians of the land on which we located, and we pay our respects to the elders, past, present and emerging. I'd also like to acknowledge Medibank for their support in making these podcasts available. So let's turn to the podcast for today, which is on transitioning back to school and life for primary school age children. In our previous podcasts, we talked about secondary school age children, but today we'd like to talk about younger children. And I'm joined by Professor Vicki Anderson, who leads the clinical sciences theme at MCRI and is a paediatric neuropsychologist working across the clinical, research and academic sectors. And she is the Director of Psychology at the Royal Children's Hospital in Melbourne. I'm also joined by Professor Harriet Hiscock, who is a consultant paediatrician and National Health and Medical Research Council Practitioner Fellow. Harriet is an Associate Director of Research at the Centre for Community Child Health and Director of the Royal Children's Hospital Health Services Research Unit and Group Leader at MCRI. So these are very good friends of mine, and I'm delighted to have them here as experts here to speak to you all and to share some of their great pearls of wisdom around children going back to school in primary school. So welcome to you both.
Thank you, Sharon.
Thanks, Sharon.
So Harriet, I'm going to start with you, and I'd like you to maybe think about what's been happening. So as we're speaking, actually, primary school age children are going back to school, and in Victoria, that happens to be the younger school age children. And of course, up until now, many of us have been trying to combine home learning and working from home and all of the, I guess, complexities of trying to do that. And now finally, the kids can go back to school. And for a number of families, that's probably a really happy time. But I reckon there's probably some families out there, and in fact, interestingly, I spoke to a family this morning that I found quite surprising. Were very concerned about sending their child back to school, and were particularly worried about the COVID virus, and in particular for this child, because this child had diabetes. So Harriet, maybe just share with us what parents should and shouldn't be worried about as their kids go back to school.
Well, first of all, Sharon, I think it's completely natural that parents might be feeling worried about their kids going back to school, as will many of the kids be. I think, however, Australia's done a superb job of managing this pandemic, and we're really seeing very, very low rates of infection in children in Australia. And for example, in the state of Victoria, we can count the number of kids infected on one hand, and no kids have had to be hospitalised. So the illness in Australia in kids has been really, really mild, which perhaps is in contrast to some of the things we're seeing on the news in Europe or in the US, where that may not be the case. So while it's completely understandable that parents are anxious, I think we can take a lot of comfort in the fact that really we're not seeing many infections and they're pretty minor in our kids. I think the other thing is there's a lot of different approaches to getting kids back to school. Some schools have just reopened their doors to everyone. Other schools are doing a staggered start across primary school. But I think the common theme is that schools have thought really deeply about how to make a return to the classroom setting as safe as possible. So, for example, a lot of schools are doing temperature checks as children come through the gates. They've got hand sanitizer everywhere throughout the school. The teachers and often the parents are encouraging the kids to wash their hands. So I think that's a great message that will come out of this whole pandemic period anyway, of better hygiene. And they're doing things like staggered drop-offs at schools so that the parents aren't necessarily milling around. And even a friend of mine who's a teacher is saying she can't actually convene in the teacher common room anymore because the teachers are socially distancing as well. So I think everyone's thought pretty carefully about it. And that combined with the fact that the rates of infection in kids are low and kids in Australia are having mild to no symptoms overall is very reassuring for all of us.
And Harriet, is there anything specific we should be telling parents that they might encourage their kids to do, such as teaching them how to wash their hands, how to use tissues, those sorts of things? Should they be wearing a mask? Because you can imagine when you see all the media, it's kind of confusing for parents.
Yeah, confusing for all of us, I think, and scary. So definitely the good sensible hygiene stuff. So number one, if your child is unwell with a fever or a runny nose or a sore throat, don't send them to school. Wait until they get better and probably go and get them tested for COVID at a local testing centre before you send them back into the school setting. Certainly washing your hands regularly throughout the day, before and after going to the bathroom, before and after eating. Trying not to touch your face, which I think is really hard for primary school kids. Sneezing into your elbow is another important thing, so you're not spraying, other colleagues and peers is also important. And using tissues and then disposing of them straight away so they're not, hanging around on the desk or in the school bag. So all those good sort of sensible hygiene things are really important for parents to teach their kids about and for parents to model doing as well.
I think it's so important, Harriet, but it's really interesting. I used to work for the Department of Education and Training, and one of the big problems was trying to get soap into schools. We simply could not get soap into schools, but it has taken a pandemic, and we do have soap in schools. So I'm very excited about that. And I'm sure a lot of parents are trying to work out how to get their young kids not to pick their noses, but I reckon we could probably nail that as well. But Vicky, I might talk to you about some of the other anxieties kids might be having going back to school. And I wonder what your thoughts are about how parents might help their kids around the worries. We'll talk a bit later, I think, about the schoolyard, but let's talk about the virus itself. And what do you think parents might be able to help their kids with in terms of, I guess, understanding, eliciting, and then addressing some of the concerns kids might have?
Well, I think Harriet's actually covered some of those issues quite well. And really the important thing for parents to be doing is giving their kids clear and reliable information, and hopefully information that the school is backing up. So that will allow kids to be getting the same message from multiple different sources, and so they can feel really comfortable with that. And as Harriet's described, the various hand washing and cleanliness things are particularly important. I think one of the trickiest things for kids, and particularly primary school age kids, is this social distancing thing, because they've been home, but they've been home in their family pod where they probably haven't had to worry that much about social distancing. So getting the hang of not being able to be close to the kids who you're used to sitting close to and playing with and pulling hair and so on, that's going to be a really tricky thing. So to me, that's going to be something that's going to need to be gently and neutrally really reinforced both at home and at school for kids. I think the other part of it is that kids are really resilient in general. So some of the kids that we see at the hospital, not so resilient, but the average child is pretty resilient, and some of them have had quite a good time at home getting much of their parents' attention, even if their parents aren't that good at teachers. And so, there will be issues around that separation and the worry about going back. It's a bit like the start of a new school year in many cases. Luckily, we have lots of social media options for kids to be able to keep good contact with their friends and their peers and their school teachers, obviously, as well. So it's not as if they're going into an unknown, but the more anxious the family unit as a whole, the more anxious kids will be. And so I think being aware of those kids who are likely to be more anxious and who have more questions, and being willing to just sit and make the time to answer their questions will be really important.
Maybe I might follow up with that, Vicky, because I've been thinking about the different ages of children, even within primary school. And I think a kid who's in year 4, 5 or 6 is really developmentally quite different to a child who's just starting school in the first couple of years of school. Perhaps if we start with those older children, Vicky, and think about what are the sorts of issues that might be arising for them, their parents might need to specifically address, where we've got some nice tips for parents and can really sort of work through what some of the anxieties might be for those children. And also, I guess, some of the things they might be looking forward to.
Yeah. So I think, my experience from my nieces and nephews is that they're really happy to be going back to school. And so that's a really nice kind of message. But they are concerned about whether or not they'll get these things right. And a couple of weeks ago, I went for a walk with my 9-year-old niece, and we would initially walk with our arms around one another, and I kind of just by habit went to do that, and she looked at me strangely as if to say, "No, you can't do that, Auntie Vicky." So I think those kids get the rules, and so long as they're part of the routine at school, they'll be fine with that, and it will become part of their school life, at least for the foreseeable future. So I think there's also and we might talk more about this later, but I think that there's also the kids that in their lives need to socially distance. So kids who have immune problems or kids that might have social difficulties, and they're used to doing this all of the time. So they're actually feeling quite pleased with themselves because they're ahead of the game in this instance. They feel more part of things than they have in the past because everyone has to social distance.
And maybe from that we'll just go back to Harriet to talk about the younger kids. And I wanted to just get your thoughts, Harriet. I have a friend of mine whose daughter has just sort of really started the first year of school and was kind of there for 5 minutes. And we had this similar thing thinking about the year 7s. They're kind of there for 5 minutes and then they were out again. So I'd really be pleased to get your thoughts on those younger kids. They've just started this structure and then they're back to being unstructured again. So the little kids who may not be able to make as much sense developmentally of what's going on around them, and also how much they can do social distancing, because of course I think the younger you are, the harder it is to really do that sort of stuff. And sort of in childcare we didn't see any social distancing and those kids actually were completely fine. So it's kind of a bit contra, isn't it, how much social distancing at what age and what's reasonable and what's not reasonable. So what are your thoughts, Harriet?
I agree, Sharon. I think it's really hard for particularly the kids who've just started in prep, and I've got a few of those kids that I look after. So I guess there's a few thoughts. One is, talking to them about what social distancing means. And I've got an image in my head of the people sitting in cafes in Germany with the pool noodles on top of their head, which measure, that 1.5 metre distance. So even just showing them what that means, knowing that they're not going to stick to that, but giving them an idea of what, staying apart from your friends physically means. So they've got a bit of a concrete idea, might be quite useful before they go to school. I think talking to them about how the school might have changed. So, you might be having a temperature check as you go in. What does that look like? And show them a picture of that so they're not thinking they're going to have a thermometer put somewhere they don't want to have put. And maybe their classroom desks will be spaced out. Maybe they'll have staggered lunch times or shorter lunch times. So really trying to prepare them for what the school might look like. And that should be done with information from the school, who I think most schools have been absolutely brilliant at doing this. But look, it's going to be hard for preppies and grade 1s to socially distance. They are particularly looking forward to going back and seeing their friends, I think a lot of them. And as you say, we've seen this happen in, the early childhood sort of setting, and we haven't had any major outbreaks. So it's not to say we won't see any outbreaks in schools, but I think we can be reassured that hopefully will be the minority, not the majority.
And Harriet, should parents be worried that their kids haven't been at school for some of them 9 or 10 weeks? Should they be worried about that?
It's Certainly not in early primary. The teachers are skilled at catching kids up and seeing where things are at. They know that some kids have not been able to learn from online, or if they have, they've been really doing a heavily reduced curriculum. The teachers are experts in that, so they'll adjust to that and they'll look after the kids with that. And I think particularly in early primary, we need to put this in a greater scheme of things. So, in the whole of a child's 13 years of schooling, this is 2 months worth. So we need to put that into perspective as well.
And maybe I'll turn to you, Vicky, and just, you mentioned before some of those kids that sort of might have thought about schooling differently from quite a time, the kids who might already have social impairments, etc. But there's also a group of kids, I guess, who are living in pretty adverse circumstances in their homes, some of whom have been at school, some of whom have not, some of whom have been maybe in sort of hot houses that might not have been great for them. Is there anything that you're thinking about in terms of both for parents to prepare some of those kids, and I guess maybe, we don't know who's listening to this, but maybe some teachers are listening to this, and maybe some things that teachers might think about for some of those kids who are returning back from maybe less than favourable home environments?
Yeah, I think that's a really important question, Sharon. And we know that the amount of family violence that's been happening during this period has really risen compared to pre-COVID times. And so there will be a lot of kids who've been living in really risky environments. I imagine some of those kids will be quite worried about leaving their mums who will be at risk. And so they may experience separation anxiety and school refusal. And I suppose, as we would expect in normal times, teachers are in a really great position to be able to pick up on some of these kinds of new and sort of unexpected or unusual behaviours in kids, and be able to look a little bit deeply to see what's going on. I think that we'll find a significant increase in the mental health problems within those particular kids, but it may come out in many ways. It may come out in anxiety, but it might come out in acting out behaviours and really difficult to manage kinds of behaviours. But equally, it might be more trauma-like behaviours such as distractibility, where kids are not able to learn like they used to. So I think teachers have so many different roles in this context to be able to really pick up the kids that might need a little bit of extra TLC or more.
And I guess related to the parents, there's been this really interesting time, particularly with the younger children, where parents have had this unusual insight into the classroom. So there's been parents in classrooms, and I've been speaking to some of my teacher friends that saying there's this really unusual situation where they're sitting and engaging with the child, but there's also a parent. So for the first time, two things are happening. Teachers are engaging with parents in ways they haven't, and parents are engaging with teachers in ways they haven't to get insights into their child's learning. Harriet, what do you think are the positives of that in terms of this kind of parent-teacher engagement that has been very interesting, right to the point where there's been flowers sent to teach, there's just been this real appreciation of the teacher.
Well, I think that's it. I think parents have really got how much teachers do and how much they have to cover the spectrum of social, emotional and academic development in any one given class. So I have a lot of my colleagues who are also parents of primary school kids, and they're exhausted, partly because they're trying to juggle their own work at home and help their kids with schooling. And they are just really had their eyes opened up. So I think that's been a real positive. On the other side of the coin, of my friends who are also teachers, they've really enjoyed getting a glimpse into the family home. And so have I when I've done telehealth with some of the kids that I see. And you can just get a little idea of how the home is set up, whether it's sort of conducive to maybe schoolwork or whether it's somewhat chaotic, etc. And you can just get a glimpse into this kid's life that can then start to explain some of the behaviours that you might have been seeing and trying to manage, and just trying to get a feel from taking, talking with the parents. But, a picture does tell 1,000 words sometimes. So I think that it's been an interesting way to appreciate each other's roles in that sort of parent-teacher relationship.
And Vicky, maybe going forward, what could we do differently now? We've had this extraordinary kind of time where parents and teachers have been communicating. Parents have got a much better sense of kids learning or maybe problems with learning, to be honest.
Yeah.
What can we, and one of the real challenges I think with this time is that there's been all these changes, but there's also been this sense that maybe some of these changes are actually for the good.
Yeah.
And I just wondered what your thoughts were for kids going forward in primary school. What are the sorts of positives that might come out of this that maybe we should keep?
Yeah, I mean, it's really following on from those comments from Harriet about engagement between parents and teachers, because I think, often through no one's fault in particular, parents and teachers get on opposite sides of the fence, and so they're not working together. And I think this has really provided not just the opportunity to see how important the teacher's role is and how complicated it is, but for parents to upskill too. So maybe with the exception of maths, which is always way too complicated for parents, but in many other areas, just seeing how teachers get the best out of kids and what the teachers' expectations are in terms of the amount of time kids should be concentrating. So, so many times in clinical practice, there's conflict between kids and parents about how much time they should spend doing their homework. But in fact, in the classroom, often they'll only focus for about 10 minutes, whereas at home, the parents are trying to get them to focus for half an hour or an hour at the end of the day. Yeah. So, I think there's that real insight, that shared insight is so valuable. I'm not quite sure whether many people are going to be that keen on continuing with online education. Certainly in our world, I think we'll continue with Zooming. But I think, the best place for kids to learn is at school with their peers around them, where they've got that holistic social integration and learning integration. I think that the group of kids that it's probably been most interesting for is the group of kids who have learning difficulties. As clinicians, we often say one-on-one teaching is the best way to get these kids keeping up with their peers, and that's been an opportunity that parents have had more than they probably wanted in this particular context. But again, showing just how difficult it is really useful, and hopefully that will mean that parents who haven't really acknowledged that their child might have some problems will be more aware and be able to feel that it's time to get some support. Some extra support.
Yeah, and I've seen that, Vicky, in one of my patients I look after, and the mum said, it's every time there's an English or a language-rich, period of teaching that she just can't follow it. She just tunes out. And so it's really opened the eyes of that mum to that problem. And so now they're more open to getting help and support around that.
And I've similarly had teachers who are friends of mine who have said that parents have finally sort of understood how challenging that child is in the classroom, whereas previously, and I think this goes to your point, Vicky, there's been this kind of us and them between the teacher and the parent, where the parent's gone, oh my goodness, my child is so hard to teach. And I think that means the teacher and parent can come then together about what's best for the child rather than this us and them. So I think that's been very helpful. But Harriet, and this is probably my last question, I'm sort of taken by the kind of the way we've kind of embraced this kind of online way of interacting. And I'm wondering what your thoughts are. You and I work quite a bit on children who are living in disadvantage, and, your point, Vicky, about children with learning difficulties, and, to get a private tutor to see a child with learning difficulties is actually really expensive. But I wonder if there's different ways of doing things now where you could get a tutor really from anywhere across the globe, really, and different kind of more efficient ways of working with kids. And I don't know if you've given any thought to that. I've put this question to you a bit on the spot, but is this a moment in time where we can think about how we support, in particular, disadvantaged kids who might have learning difficulties, etc., in ways we haven't thought of before?
So my answer is probably Probably. I'm just drawing upon some of the allied health colleagues that I have, speech therapists, psychologists, and they've said to me that online therapy has been pretty challenging unless they've got a really good relationship already with the child that they've been looking after. So I think that would be quite hard to set up from the get-go, certainly in the primary school years. My son actually does a lot of tutoring of year 11 and 12 students and who he hasn't met, and that's transitioned beautifully to online. But I think for the younger kids, there needs to be some rapport, first of all, between the tutor or whoever else it might be, and once that rapport is established, then yes, I think absolutely. And the beauty for families that they've expressed to us a lot through our telehealth consults, for example, is they don't have to pack up the child into the car, drive them somewhere for that tutoring. They can do it from the comfort of their own home, and that's worked really, really well, particularly those who might live, rurally or regionally, and access to this help can be really difficult.
And Vicky, I'll give you the last word on this. And I think particularly in your role as a psychologist and a neuropsychologist, where obviously testing would be also challenging in this environment. But I throw it open to you to think about what are your thoughts about some of these positives that might be particularly helpful for kids who are living in disadvantage, who can't access a lot of these expensive strategies as it currently stands anyway.
Well, I think, we've seen lots of different activities that have gone from one-on-one to group via Zoom. So to me, that's an obvious opportunity for some of the kinds of interventions there are out there. I do agree with Harriet that the kids who are socially disadvantaged or those that have learning difficulties often are not very trusting in the learning environment. And so you do need to do a bit of work to begin with. But I can't see any reason why once that rapport has been achieved, you can't do it via these kinds of video conferencing platforms. And the other advantage to that sometimes we see as a disadvantage within the face-to-face context is that these kids can actually then see how other kids are doing, and particularly if you're able to put them in similar level groups in terms of their skills, then there's that capacity for bonding and feeling like you're not the only person that has these problems. Whereas currently with interventions that are external to school, which are often the specialist interventions, they're very much one-on-one. So I think there really are some advantages from that kind of it's the opposite to social distancing in this particular case, but being able to be in a group of like minds or like abilities.
I think that sounds great. And I really wanted us to end on a note that just said, COVID has been sort of talked about as the great accelerator. And I think we should definitely think about that when we're thinking about opportunities for our children. So thank you so much to both of you for sharing your insights today. I think it's been so helpful for both parents and for teachers who may be listening as well. Once again, I want to thank Medibank for their support in making this podcast series possible. Now, of course, if those of you who are listening to this, if you have any tips or tricks you'd like to share or a question for our guests, please let us know at podcasts@mcri.edu.au. And of course, if you'd like any further information on any of the issues we've talked about today, visit raisingchildren.net.au and have a look at the links both on our notes and on Raising Children. If you found this episode helpful and think your friends and family may benefit, please share it with them and give us a rating, please. Now, we're going to be coming back to you soon with an episode talking about transitioning. No, we're not going to do that. Let me start that again because that's this one. We're going to come back to you soon with an episode focusing solely on the coronavirus itself and give you some insights on what we know to date and what the future might look for us. Make sure that you follow up if you need to on the Raising Children Network or Beyond Blue or Headspace. And of course, all of these can provide support if you need it. Thanks for joining us, and we'll see you and hear from you at the next podcast.